So this is a pre-tension load to the upper back and through this target tissue. There's two different ways you can do it. You can do it seated or you can do it standing. I'm going to show you seated because there is an additional step to it. So the additional step is taking your hand and grabbing onto the surface that you're sitting on. And what that does, it helps depress and keep the shoulder downward. So the first step you're going to do is you're going to turn your head towards the side you want to work on and then side bend your head away from it. So turning towards and then bringing the ear towards the opposite shoulder or armpit. Then you're going to hold that until you feel some tension. Once you feel the tension, the first thing you're going to do is you're going to bring the shoulder either backwards or forwards, trying to feel more tension. So when I'm doing this, I actually feel more tension when I bring my shoulder backwards, so I'm going to hold that position. Once I hold that position, then the next thing I'm going to do is I'm going to side bend my body away. So I'm actually going to drop this shoulder down towards this hip until it creates more tension in through this side, and I'm going to hold that there. After that, now I'm going to slouch slightly or straighten up all the way. So I'm going to slouch or straighten up. Again, what you're trying to look for is increase in tension. So if you feel more tension when you're slouching, you're going to hold that position. If you feel more when you're sitting up, you're going to sit up nice and tall. I feel more when I'm sitting up nice and tall, so I'm going to hold that. The last thing I'm going to do, which will be the driver, the thing that we're going to be working on, is we're going to use the opposite hand. So I'm going to start reaching towards my opposite knee. That's where I'm going to start. Then I'm going to go to my wrist, my elbow, then my shoulder, trying to see if I can feel more tension in one spot versus the other. And I think I feel more tension when I actually go towards my shoulder. So I'm going to aim towards my shoulder and hold that position. I'm going to hold it for a second or two, and then I'll slack off just a smidge. And then I'm going to try to go a little bit further, trying to reach towards my shoulder and wrap my hand around my shoulder. So with each attempt, I'm trying to go a little bit further than the previous attempt. Just hold that there, relax, and I'll try that one more time, trying to reach. And again, you should feel that in the target tissue, which is right in through this upper back. And hold that.